Hello everyone, welcome back to my channel. Today, we'll do a rapid review of 100 key skeletal system conditions and definitions. This video is designed for quick revision and memorization of high-yield terms for pharmacy school. Bone disorders: fracture, break in a bone, stress fracture, small crack from overuse, greenstick fracture, incomplete fracture in children, comminuted fracture, bone broken into pieces, compound fracture, bone breaks through skin. Bone disorders: pathological fracture, fracture due to weak bone, osteoporosis, loss of bone density, osteomalacia, soft bones in adults, rickets, soft bones in children, osteopenia, low bone density. Bone infections and inflammation: osteomyelitis, bone infection, periostitis, inflammation of bone covering, septic arthritis, infection of joint, reactive arthritis, joint inflammation after infection, tuberculous arthritis, TB, infection of joints. Joint disorders: osteoarthritis, degenerative joint disease, rheumatoid arthritis, autoimmune joint inflammation, gout, uric acid crystal arthritis, pseudo-gout, calcium crystal arthritis, ankylosing spondylitis, inflammatory spine arthritis. Joint disorders: septic joint, bacterial joint infection, synovitis, inflammation of joint lining, bursitis, inflammation of bursae, joint effusion, excess fluid in joint, joint stiffness, reduced joint movement. Spine disorders: scoliosis, sideways spinal curvature, kyphosis, excessive outward spinal curve, lordosis, excessive inward spinal curve, herniated disc, slipped intervertebral disc, degenerative disc disease, disc wear and tear. Spine disorders: spinal stenosis, narrowed spinal canal, spondylosis, degenerative spine changes, spondylolisthesis, vertebra slips forward, spina bifida, congenital spinal defect, compression fracture, collapsed vertebra. Congenital and developmental disorders: achondroplasia, genetic dwarfism, osteogenesis imperfecta, brittle bone disease, cleidocranial dysplasia, abnormal skull and clavicles, congenital hip dysplasia, abnormal hip joint development, clubfoot, talipes, foot deformity at birth. Bone tumors: osteoma, benign bone tumor, osteochondroma, cartilage-capped bone tumor, chondroma, cartilage tumor, giant cell tumor, aggressive benign bone tumor, osteosarcoma, malignant bone cancer. Bone tumors: chondrosarcoma, cartilage cancer, Ewing sarcoma, bone cancer in children, multiple myeloma, cancer of bone marrow, metastatic bone disease, cancer spread to bone, bone cyst, fluid-filled bone cavity. Metabolic and endocrine bone disorders: Paget disease of bone, abnormal bone remodeling, hyperparathyroid bone disease, excess PTH bone loss, hypoparathyroid bone disease, low PTH bone changes, renal osteodystrophy, bone disease from kidney failure, fluorosis, excess fluoride bone disease. Trauma and injury: dislocation, bone displaced from joint, subluxation, partial joint dislocation, sprain, ligament injury, bone bruise, microfracture injury, growth plate injury, damage to developing bone. Cartilage disorders: chondromalacia patelli, softening of knee cartilage, costochondritis, chest wall cartilage inflammation, cartilage degeneration, breakdown of cartilage, osteochondritis dissecans, bone and cartilage separation, intervertebral disc disease, disc cartilage disorder. Inflammatory and autoimmune: psoriatic arthritis, arthritis with psoriasis, reactive spondyloarthritis, inflammatory spine disease, juvenile idiopathic arthritis, childhood arthritis, systemic lupus erythematosus, autoimmune joint involvement, polymyalgia rheumatica, muscle and joint pain disorder. Bone deformities: bow legs, genu varum, outward leg curvature, knock knees, genu valgum, inward knee curvature, flat feet, pes planus, loss of foot arch, high arch foot, pes cavus, excessive foot arch, hammer toe, toe deformity. Growth and aging conditions: delayed bone growth, slowed skeletal development, advanced bone age, early skeletal maturation, growth plate closure disorder, abnormal growth ending, age-related bone loss, bone thinning with age, fragility fractures, fractures from minor trauma. Miscellaneous conditions: avascular necrosis, bone death from poor blood supply. Osteitis deformans, another name for Paget disease. Bone marrow edema, fluid buildup in bone marrow. Bone spur, osteophyte, bony outgrowth. Hyperostosis, excessive bone growth. Miscellaneous conditions: hypostosis, reduced bone formation. Skeletal dysplasia, abnormal bone development. Chronic joint pain, long-term joint discomfort. Joint degeneration, progressive joint damage. Skeletal system disorder, general bone disease. Miscellaneous conditions: bone weakness, reduced bone strength. Joint instability, excessive joint movement. Mechanical back pain, spine pain due to strain. Postural deformity, abnormal body posture. Bone inflammation, inflammatory bone condition. Miscellaneous conditions: joint inflammation, inflammatory joint disease. Skeletal trauma, injury to bones. Congenital skeletal disorder, present at birth. Acquired skeletal disorder, develops after birth. Degenerative skeletal disease, progressive bone and joint disorder.